Hey, this is Jason the PT, and today I want to talk about the three most fundamental things every plan of care should have. So there's a million videos out there on exercises and stretches and so on and so forth. And a lot of them are phenomenal. I mean, they really are good stuff. But there's something that's missing in all of this. And it's those three critical things to make sure you get the most out of your physical therapy. Number one, accurate diagnosis. You'd be surprised how many times I get patients that come in that have absolutely no idea what's going on with them. They come in and they have knee pain, and maybe I have a referral that just says knee pain, or they get sciatica. Sciatica, it's a symptom, but it could be a symptom of something a little bit more sinister. And that's the other part, is pain can manifest as an orthopedic problem. You'd be surprised how many times I've had patients come in and this is not what they think it is. I've caught cancer in two patients. I had one patient that was having a heart attack, and I had one patient that probably was having a neurovascular problem. So if you don't know what you're working with, it may not even be a physical therapy problem, and you don't want to waste time if you don't have to. But you want to establish a good, solid diagnosis. If you can't, you need to get it back to the doctor as soon as possible. Second, etiology. You have to understand how a diagnosis came about. So especially with patients that don't have a real aha moment, they didn't fall down, they didn't get hurt, they didn't, it just kind of came on gradually. You need to seek out that etiology because that's the reason for the diagnosis. So once you get the diagnosis, you establish the etiology. Meniscus that's becoming problematic could be a lack of hip mobility causing over-rotation at the knee. You got to treat that hip mobility. Because if you don't take out the etiology that's causing the diagnosis, it's much harder to do the third step, which is rehab. That's where you do the exercises. That's where you do the stretches. That's where you rehabilitate those tissues to get people better. But you got to do those three things in that order. You do them in any other order or omit steps, that's very problematic. Diagnosis, etiology, then you rehab it. If you go from crappy diagnosis, not treating the etiology, and going to rehab, these are why people don't get better. That etiology continues to take away while you're trying to rehab, and patients just don't get there. So remember those three things: diagnosis, etiology, rehab. Follow me for more.